Imagine for a moment that your heart is not just an organ, but a storyteller. Every beat is a word, every rhythm a sentence, and tonight, as you lie in the dark, it is trying to tell you something urgent. But there is one thing, one seemingly harmless habit you perform every single night, that is silencing its voice, drowning out its wisdom, and slowly, imperceptibly, rewriting the story of your life toward a chapter you never wanted to read. You might think you're winding down, preparing for rest, but in reality, you are sending a signal of danger to your most vital muscle. This is not about caffeine. This is not about screens. This is about something far more subtle, far more insidious, and far more common than you could possibly imagine. It is the thing you do right before you close your eyes, the thing you believe helps you relax, but which actually triggers a cascade of biological events that keep your heart in a state of high alert long after you have fallen asleep. I am Dr. William Lee, and today we are going to uncover the hidden physiology of your bedtime routine, explore the silent damage being done to your cardiovascular system, and reveal the simple, profound shift that can transform not just how you sleep, but how you live. To understand why this specific pre-bedtime behavior is so dangerous, we must first journey into the intricate architecture of your autonomic nervous system, the unseen conductor of your body's symphony. This system has two primary movements, two opposing forces that dance in balance throughout your day. The first is the sympathetic nervous system, often called the fight or flight response. It is ancient, primal, and designed for survival. When activated, it floods your body with cortisol and adrenaline, increases your heart rate, constricts your blood vessels, and sharpens your focus. It is the engine that allows you to run from a predator or solve a complex problem under pressure. The second movement is the parasympathetic nervous system, known as rest and digest. This is the brake pedal of your biology. It slows your heart, lowers your blood pressure, promotes digestion, and initiates the repair processes that keep you alive. Health, true physiological health, is not the absence of stress, but the ability to transition smoothly between these two states. You need the fire of the sympathetic system to engage with the world, but you absolutely require the cool water of the parasympathetic system to recover from it. The problem arises when we lose the ability to switch gears, when we carry the fire of the day into the night, when we fail to engage the brake. Our hearts are forced to run a marathon while we are trying to rest. And the culprit, the thing you are likely doing right now before bed, is keeping that foot firmly on the gas. Let us look closer at what happens in the body during this critical transition period, the hour before sleep. This is not merely a time of inactivity, it is a time of intense biological preparation. Your core body temperature must drop by about 2 to 3 degrees Fahrenheit to initiate sleep. Your melatonin levels must rise, signaling to every cell that it is time to shut down. Your heart rate variability, a key marker of cardiovascular health and resilience, should increase, indicating that your heart is responsive and flexible. But if you engage in the habit we are discussing, you disrupt this delicate orchestration. You trigger a microsurge of cortisol, the stress hormone. You suppress melatonin production. You keep your blood vessels constricted. And perhaps most dangerously, you prevent your heart rate from dipping into the deep, restorative zones it needs to reach during non-REM sleep. This is not speculation. This is measurable physiology. Studies using continuous cardiac monitoring have shown that individuals who engage in this pre-bedtime activity maintain elevated heart rates and reduced heart rate variability throughout the night, even if they are unaware of it. They are sleeping, yes, but their hearts are still working overtime, still braced for impact, still fighting a battle that ended hours ago. So, what is this habit? It is not scrolling through social media, though that is certainly harmful. It is not watching the news, though that too induces stress. It is something much more intimate, much more personal, and much more difficult to recognize as harmful because it feels like relief. It is rumination. It is the act of replaying the day's conflicts, worrying about tomorrow's tasks, analyzing past mistakes, or catastrophizing future scenarios while lying in bed. It is the mental loop of unresolved tension. You might call it thinking or planning or worrying, but physiologically, it is a sustained activation of the sympathetic nervous system. When you lie in the dark and let your mind wander into the territories of anxiety, regret, or anticipation, your brain does not distinguish between a real threat and an imagined one. To your amygdala, the alarm center of your brain, a stressful thought about a work deadline is identical to a lion charging at you. It releases the same chemicals. It triggers the same cardiovascular response. Your heart beats faster. Your blood pressure rises. Your muscles tense. And you do this voluntarily, night after night, believing you are simply processing your life when in fact you are subjecting your heart to a nightly assault. Consider the sheer volume of time we spend in this state. If you spend just 30 minutes each night ruminating before falling asleep, that is over 180 hours a year. That is nearly 8 full days of continuous stress exposure added to the natural stresses of your waking life. And unlike daytime stress, where you might move, talk, or distract yourself, nighttime rumination is static. It is trapped energy. There is no physical outlet for the adrenaline coursing through your veins, so it settles. It accumulates. It damages the endothelial lining of your blood vessels. It promotes inflammation. It contributes to the hardening of arteries. Over months and years, this nightly ritual becomes a significant risk factor for hypertension, arrhythmias, and even heart attack. The heart, remember, is a muscle that relies on rhythm and rest. When you deny it that rest, when you keep it in a state of low-grade panic, you are accelerating its wear and tear. You are aging your cardiovascular system faster than time itself would dictate. But why is this so hard to stop? Why do we cling to this habit even when we know it leaves us feeling tired and anxious? The answer lies in the illusion of control. In the quiet of the night, with no external distractions, our minds seek to make sense of the chaos of our lives. We believe that if we just think about the problem long enough, we will solve it. We believe that if we anticipate every possible negative outcome, we will be prepared. We mistake worry for preparation. We mistake rumination for problem solving. But neuroscientifically, they are entirely different processes. Problem solving engages the prefrontal cortex, the logical, planning part of your brain. It is structured, goal-oriented, and finite. Rumination, on the other hand, engages the default mode network, a web of brain regions associated with self-referential thought, memory, and emotional processing. It is circular, unstructured, and infinite. It does not lead to solutions. It leads to deeper entrenchment in negative emotion. It does not prepare you for tomorrow. It steals your energy for today. And it does this while your heart pays the price. To break this cycle, we must first recognize it for what it is, a physiological stressor, not a mental necessity. We must understand that the bed is not a conference room for your anxieties. It is a sanctuary for your recovery. And to protect that sanctuary, we need to introduce a new ritual, a buffer zone between the chaos of the day and the peace of the night. This is not about suppressing your thoughts or forcing yourself to sleep. It is about changing the channel of your nervous system. It is about actively engaging the parasympathetic brake before you even get into bed. One of the most powerful tools for this is the practice of physiological sighing. This is not deep breathing in the traditional sense. It is a specific pattern, 2 short inhales through the nose, followed by 1 long, extended exhale through the mouth. This pattern mechanically opens the alveoli in your lungs, increasing oxygen uptake and stimulating the vagus nerve, the main conduit of the parasympathetic system. Doing this for just 2 to 3 minutes before bed can significantly lower your heart rate and reduce feelings of anxiety. It signals to your body that the danger has passed, that it is safe to rest. Another crucial element is the creation of a cognitive shutdown ritual. Just as you shut down your computer at the end of the day, you must shut down your mind. This can be as simple as writing down your worries on a piece of paper. By externalizing your thoughts, you remove them from the loop of rumination. You tell your brain, I have acknowledged this. I will deal with it tomorrow. It does not need to be held in my head right now. This act of transfer is surprisingly powerful. It frees up cognitive resources and reduces the emotional charge of the thoughts. Combine this with a sensory anchor, such as a specific scent, a soft blanket, or a calming piece of music, and you create a conditioned response. Over time, your brain will associate these cues with safety and rest, making the transition into sleep smoother and more automatic. You are essentially retraining your nervous system to let go. We must also address the environment in which this happens. Your bedroom should be a cave. Cool, dark, and quiet. Light, especially blue light from screens, suppresses melatonin and keeps your brain in a state of alertness. But beyond light, consider the sound. Silence can sometimes be deafening, allowing intrusive thoughts to echo louder. For many, a low-level white noise or nature sounds can provide a gentle auditory blanket, masking sudden noises and providing a consistent backdrop that helps the mind settle. Temperature is also critical. As mentioned, your body needs to cool down to sleep. A room that is too warm keeps your metabolism active and your heart working harder to regulate your temperature. Aim for around 65 to 68 degrees Fahrenheit. This slight chill encourages the drop in core body temperature necessary for deep sleep. Now, let us zoom out and look at the broader implications of this change. When you stop ruminating before bed, you are not just improving your sleep quality. You are improving your cardiovascular health. You are lowering your baseline blood pressure. You are reducing systemic inflammation. You are enhancing your heart rate variability, which is a strong predictor of longevity and resilience. But beyond the physical, you are reclaiming your mental space. You are learning to trust that the world will continue without your constant vigilance. You are practicing the art of surrender, not as weakness, but as wisdom. You are acknowledging that some things cannot be solved in the dark, and that rest is not a luxury, but a biological imperative. Think of your heart as a faithful companion. It has beaten for you since before you were born. It will continue to beat until your last breath. It asks for very little in return: movement during the day, nourishment from food, and rest at night. When you lie in bed and churn over your worries, you are ignoring its plea for peace. You are asking it to carry the weight of your mind when it should be carrying only the rhythm of your life. By letting go of this habit, you are offering your heart a gift. You are giving it the space to repair, to strengthen, to prepare for the next day. And in doing so, you are giving yourself the gift of presence. You are allowing yourself to wake up refreshed, not just physically, but emotionally. You are starting the day from a place of calm rather than a place of deficit. This shift requires patience. It is not something that will happen overnight. Your mind has been trained to ruminate, and it will resist change. There will be nights when the thoughts come flooding back, when the urge to analyze and worry feels overwhelming. On those nights, be gentle with yourself. Return to the physiological sigh. Return to the paper and pen. Remind yourself that you are safe, that you are resting, that the work of the day is done. Each time you choose rest over rumination, you are strengthening a new neural pathway. You are teaching your brain that it is okay to let go. And over time, this new pathway will become the default. The old habit will fade, not because you fought it, but because you replaced it with something better. Consider the alternative. Imagine continuing down the current path. Night after night, your heart races in the dark. Your blood pressure stays elevated, your sleep remains fragmented. You wake up tired, irritable, and anxious.